We have reached a unique junction in the history of healthcare. Historically, physicians have been trained to keep the money out of medicine. We don't necessarily want our physicians thinking about exactly how many x-rays is it going to take to get to the right diagnosis. While this philosophy was made with the best intentions in mind, the result has been nothing short of spiraling health costs. This graph demonstrates the worldwide healthcare spending as a percent of GDP over time. Each point on the graph represents every single country that was surveyed by the World Health Organization. As you can see from the graph, the healthcare spending has increased over time. And still, for all that we're paying, there's still room for improvement in patient outcomes. From this graph, we're looking at patient outcomes over time. The patient outcome we chose to measure, while there are many, is child mortality. This was defined by the World Health Organization as children who passed away at the ages of 5 years or below. These are worldwide metrics as measures of patient outcomes. From the graph, the y-axis represents the rates among the countries. In the x-axis, we have time. As you can see from the graph, there exists variation. However, over this time period, it is overall static.
Medicine is entering a new era where patient quality of outcomes and containment of medical costs must stand side by side. For our report, we've done an in-depth statistical analysis of the problem, studied many of the commonly attributed causes, and shown why we think information technology is the answer. Internet proliferation is going to save medicine, and today we're going to show you why. But first, let's define the problem. As we mentioned before, physicians and those drawn to the industry have traditionally been siloed into managed healthcare. This approach has been the extent of management training. Doctors have also been highly resistant to current attempts to quantify value in medicine. As the saying goes, not everything that can be counted counts, and not everything that counts can be counted. As a result, most metrics for medical effectiveness are simple and negative. Patient mortality, infection rates, readmission rates, and of course, death rates. In our case, for our metric, we chose child mortality. We acknowledge that this isn't a perfect indicator, but our data shows it's a strong one. So, with those two limitations, physicians' unwillingness to think about cost as a primary issue and their resistance to having that cost quantified by others, how do we perform a big data project on medical effectiveness? Well, we start with our question. First, does the current system provide value to patients? Do we need what we have now, just more efficiently, or do we need a fundamentally different system? Second, where is this increase in cost coming from? And third, what do we do about it?
The first question is the easiest to answer. Do physicians using their present methodology add significant value to patients? Yes. This is a graph showing average child mortality rates from 2005 to 2012, plotted against the density of trained physicians by country. Very straightforward. Physicians save lives, about what you'd expect to see. But this brings us to our second question. What is the cause of all the rising costs? After all, if 10 times as many physicians is 10 times as expensive, this graph doesn't mean that much, does it? But that's not what we see. You know what we do see? Each dot represents a country from 2005 to 2012. There is almost no correlation between the number of doctors and total medical costs. And if you stop and think about that for a second, that is insane. Doctors are the primary care providers in medicine, as well as some of the most skilled labor in the world, and they're evidently not a major contributor to the bottom line. You can run the same calculation with nursing and support staff. And even with pharmaceutical staff. And you see the same lack of correlation. In fact, when we throw doctors and total medical expenses up on the same graph, you can see that total medical expenses, the black line, has far less impact than density of doctors, and that the two don't change together.
So where is all this money going? It's going to administrative costs. 25 to 30% of all healthcare costs are administrative. We believe that this burden is an opportunity where technology can help. With this in mind, we took a look at how the internet, the greatest invention of our era, has impacted healthcare costs. In this graph, we're looking at internet usage plotted against child mortality. Along the x-axis, we're looking at internet usage as a percentage of the population, and along the y-axis, we're looking at child mortality rates. The black line is showing the general trend of what's happening, and the bubbles represent the individual countries. As you can see, there is a strong negative correlation for internet usage and child mortality. Just a 5% increase in internet penetration causes a 27% decrease in child mortality. The effect becomes even more extreme when you plot it alongside total medical expenses. As you can see, there's a lot going on in this graph, so let's take a minute to explain. Plotted along the y-axis, we're looking at child mortality rates. Plotted along the top of the x-axis, we're looking at internet usage as a percentage of population. These results can be seen in red. Plotted along the bottom of the x-axis is total medical costs as a percentage of GDP. These results can be seen in black. The squares and the circles that you're seeing on the screen represent the individual countries for each of these metrics. Again, just a 5% increase in internet usage is equivalent to spending 20% more of a nation's total GDP on medical costs. To put that in practical terms, each person with an internet connection worldwide saves $64 of medical costs a year. Now you may be thinking, surely internet use is associated with other factors. After all, access to the internet isn't free, so maybe the reason that internet access correlates with better health outcomes is that people who can afford an internet connection can better afford doctors. In fact, we saw that this relationship isn't as strong as you would think it is. What we see here is a graph plotting doctors against internet users. The number of doctors is along the bottom x-axis, and the individuals using the internet is along the y-axis. The circles are representing individual countries.
So you can see that the positive impact of internet availability is not solely caused by access to money or physicians. It really does improve care on its own. Now, there are people that have argued that technology itself is part of the problem, that tech is responsible for rising healthcare costs. But when we test that assumption, as you can see on the graph, internet usage is on the y-axis, total medical cost as calculated as fraction of GDP is on the x-axis. Each dot represents a country from 2005 to 2012. Looking at this graph, we see that the idea that tech causes medical costs is not well supported. Internet usage dramatically lowers child mortality worldwide, and it does it without increasing healthcare costs. In summary, information technology, manifest as the internet, is an incredible tool for improving healthcare. It improves patients' outcomes, and used in conjunction with physicians, has the potential to lower healthcare costs.